So today's topic is the blood pressure measurement. So what is blood pressure? Now blood pressure, that is the measurement of the force against the walls of the arteries as the heart pumps blood throughout the body. That is called the blood pressure. And we have measured this blood pressure in millimeters of mercury. Okay. And here we have to understand that 1000 pascal is about 7 millimeters of mercury. That is to be calculated. Okay. So when basically blood pressure reading is taken in two numbers. One is the systolic and the diastolic. Now what is the systolic? That is the measure of the pressure as the heart is beating. Okay. So in the systolic phase, what happens? The heart contracts, blood pressure rises, and blood moves out along the vessels. That is the uh, situation when systolic happened. And in case of diastolic, so it is a measure of pressure while the heart is at rest between the beating. And in this phase, the heart releases, blood pressure falls, and the blood fills the heart. That is the diastole. Now these two readings that can be uh, taken in terms of blood pressure measurement. So blood pressure risks, when it is high, there are several risks we can found it. That is chest pain may be occurred, maybe heart attack, heart failure, kidney failure, stroke, or blocked arteries in the legs or arms, eye damage, so etc. And in case of low blood pressure, there are also risk of reduce the blood flow to the brain and other vital organs, uh, fainting, dizziness or fainting, lack of concentration, blood vision, fatigue, cold and clammy skin, and rapid shallow breathing. So in case of high blood pressure, hypertension may be occurred, and this time the blood pressure changes all the time. It decreases when we sleep or when we at rest position, and it will be increased when we are about to active or we have to excite, uh, in practicing sports, straits and the nervous. Now changing of blood pressure, that is a vital part of a healthy cardiovascular system. Okay. And hypertension or high blood pressure, that is happened when the blood pressure stays too high over an extended period of time, and that can cause the heart to have to work too hard, and the force of the blood flow that can damage your arteries, or uh, maybe heart, or maybe kidneys, brain and eyes. The total nervous system may be affected. Now this is the uh, readings. This is the normal blood pressure count, and the pre-hypertension or the hypertension. In case of these two situation, what will be our systolic and diastolic pressure, that can be given over there. So normal, in case of normal blood pressure range, that is between 120 by 80, and maybe a lower, maybe sometimes it is for 110 by 70 for someone. That is also normal. So in case of this one, pre-hypertension, what will be the range? That will be between 120 by 80 to 140 by 90. And if hypertension occurred, that the range will be higher than this, which will be 140 by 90 or maybe higher of that. Now there are several ways blood pressure measurement. Actually, how can we measure the blood pressure? There are several ways to perform this function. Now, basically, mm, what I meant, the blood pressure, which that can be quite readily measured in that is one of the physiological variables to indicate that the um, status of our cardiovascular system. Now, blood pressure is generally measured by two methods. One is the indirect method, another is the direct method. Under indirect methods, um, here it is the non-invasive type, and it is safe and it less expensive. Okay, as for example, sphygmomanometer or a rheographic method or oscillometric method, ultrasonographic Doppler method, etc. And in case of direct method, it may be invasive, and which where the catheter may be inserted into the vascular system. As for example, the percutaneous insertion or catheterization technique. So, in case of indirect measurement, which is basically the normally use the sphygmomanometer or auscultatory method. So this is the most familiar indirect method of measuring the blood pressure, involves the use of this type of instrument, which is called the sphygmomanometer and a stethoscope. Now, the sphygmomanometer, it is composed of a inflatable pressure cuff and a mercury or aneroid barometer to measure the pressure in the cuff. Okay, and the cuff has a rubber bladder inside an inelastic fabric covering that can be wrapped around our upper arm and fastened with either hooks or a Velcro fastener. That cuff, that is when it is inflated manually with a rubber bulb and deflated slowly through a needle valve, a wall mounted sphygmo mm, manometer, that is over here, this type of sphygmomanometer is there, and these devices are also uh, used as a portable units for the ease of usage. Okay, what is the principle behind this, how it works? The Actually, the principle of sphygmomanometer is that when the cuff is placed over um, on the upper arm and inflated, arterial blood can flow past the cuff only when the arterial pressure exceeds the pressure in the cuff. When the cuff is inflated to a pressure that only partially occludes the brachial artery, what turbulence is generated in the blood as it spurts through the tiny arterial opening during each systole, and it this turbulence basically generates one sound which is called the Korotkoff sound. Korotkoff sound. So this Korotkoff sound that is heard through a stethoscope placed over the artery downstream from the cuff of the patient. Okay, so a sphygmomanometer and a stethoscope method of a blood pressure measurement, it is very regular measurement, and where the pressure cuff on the upper arm is first inflated to a pressure well above the systolic pressure. Okay, at this point, no sound can be uh, heard through the stethoscope, which is placed on the brachial artery, because that artery has been coalesced by the pressure of the cuff. So when the pressure is reduced through the needle valve, Korsakoff sounds begin to it is to be heard through the stethoscope. And the pressure of the cuff, that is indicated on the manometer, when the first Korsakoff sound uh, is heard, is recorded as the systolic blood pressure here in this position. Now the pressure in the cuff continues to be dropped, the Korsakoff sounds, um, and, um, and it continue until the cuff pressure is no longer sufficient to occlude the vessel during any part of the cycle. And below this, the pressure, the Korsakoff sound disappear, making the value of the diastolic pressure in this point. Okay, so uh, the most familiar method of locating the systolic and diastolic pressure values by listening the Korsakoff sound is called the uh, auscultatory method of sphygmomanometry. Okay, so this way, in this way, this is measured. Now there are certain advantage and disadvantages. The first advantage is the this method is very simple and does not require much equipment, but it has certain disadvantages also. Like it cannot be used in noisy environment because you can't hear the coroscope sound. So the environment should be very it will not be so noisy that you cannot heard the sound. Otherwise, if you have missed the systolic, the first coroscope sound, which will be uh, treated as your systolic pressure, and the last coroscope sound, which will be used for diastolic pressure, you can miss that. The observation that is differ from observer to another because it's a wall mounted the manometer, so mercury manometer is there, so it depends on the observer how it observes the reading. There may be some error. Okay, human error. Now a mechanical error might be introduced into the system, for example the mercury leakage or air leakage or obstruction in the cuff may be there. So that will be one disadvantage. Another is the observation do not always correspond to uh, with the intra-arterial pressure, and it doesn't give the accurate result for infants or hypotensive patients. Next is, so that was the manual method, and here is the automated indirect method. Okay, so uh, now due to the uh, trauma imposed by direct measurement of blood pressure and the lack of more suitable method for indirect measurement, so several attempts have been made to automate the indirect procedure. So as a result, a number of automatic or semi-automatic systems have been developed, and most devices are of type that utilizes a pressure transducer connected to the sphygmomanometer cuff, a microphone placed beneath the cuff. Okay, which is attached over our artery, and a standard physiological recording system on which the cuff pressure and the cuff sound that can be recorded. So the basic procedure parallels the manual method. Here the pressure in the cuff is automatically inflated to about 220 millimeter of mercury to mm, so so, so it will be within this range, 220 millimeter of mercury, and it is allowed to deflate slowly. Now the microphone picks up the cork sounds from the artery near the surface just below the compression cup, and the pressure reading at that time of first sound, which represents the systolic pressure, also, and the diastolic pressure, which is the point on the falling pressure where the last sound is sensed, that can be recorded. Now some of this uh, commercially available automatic blood pressure meters work well when demonstrated on a quite healthy subject, but fails when used to measure blood pressure during activity or when used on patient in circulatory shock. So methods other than this detecting the Korsakoff sound utilizing ultrasonic Doppler methods are very useful in these situations. So while the clinical diagnostic value of systolic and diastolic blood pressure has been clearly established, the role of mean arterial pressure, in short, it is called MAP, as an indication of blood pressure trend, has become more widely accepted with the expanded use of the direct pressure monitoring using arterial cannula with electronics transducers and displays. So most electrical monitors now provide both diagnostic systolic diastolic waveform information and the added option of a single value of mean arterial pressure indication. So it is now generally recognized that mean arterial pressure, that is a direct indication of the pressure available for tissue perfusion, and that a continuously increasing or decreasing mean arterial pressure that can ultimately result in hypertensive or hypotensive crisis. Okay. So mean arterial pressure, what is that? It is the average. Uh, it is a weighted average of systolic and diastolic pressure, and it is influenced by cardiac outputs and the systemic vascular resistance, each of which is influenced by several variables. Now, one common method has to be um, so it is established that mean arterial pressure, which is equal to the diastolic pressure plus 1 by 3 of systolic pressure minus diastolic pressure, which means that mean arterial pressure, which is equivalent to as well as the diastolic pressure plus 1 by 3 of pulse pressure. So, because in most clinical situations, systolic and diastolic pressures correlate with each other, and mean arterial pressure, which is determined from the systolic pair, critical patient arterial pressure trends can be monitored by observation of this mean arterial pressure limits. Okay. So adjustable alarm limits as required for a given critical situation that can then alert the staff of possible patient's problem, and these units can be used in operating rooms or recovery rooms or intensive care units also. Okay. So a system that can measure the blood pressure automatically at pre-programmed time on a continuous basis and during the normal activities of patient. Such machine can measure uh, blood pressure on a continuous basis for 100 pre-programmed time, along with this what is known as Holter electrocardiograph. Okay, and this way the physician can get the information of the patient health on a 24 hours basis. Okay. Next is the direct method. So the blood pressure is measured using one of this method. One is the percutaneous insertion or catheterization or implantation of a transducer in a vessel or in the heart. So it so here in this picture it gives a general idea of these methods. For a percutaneous insertion, what happened, a local anesthetic is injected near the site of invasion, and now this the vessel of that is occluded, and a hollow needle is inserted at a slight angle towards the vessel. So when this needle uh, is in place, a catheter is laid through a guide. So when this catheter is in place in the vessel, the needle and guide are withdrawn. For some measurement, typical type of needle attached to an airtight tube is used so that the needle can be left in the vessel and the blood pressure sensed directly to by attaching the transducer to a tube. Okay, so other types have the transducer built into the top of the catheter. Now, apart from obtaining the blood pressures in the heart chambers and these great vessels, so catheterization technique is also used to obtain the blood samples from the heart for oxygen content analysis and to detect the location of the abnormal blood flow pathways. Okay, so also catheters are used for investigations with injection of radio opaque dyes for X-ray studies, colored dyes for indicated dilution studies, and of vasoactive drugs directly into the heart and certain vessels. So a catheter is a long tube that is introduced into the heart or a major vessel by way of a superficial vein or artery. Okay, so in this type of measurement, catheter type technique of blood pressure is so how it works. A sterile saline solution is introduced into a catheter so that the fluid pressure is transmitted to transducer outside the body. Now, a complete fluid pressure system is set up with provision for checking against the atmospheric pressure and for establishing a reference point. And the frequency response of this system is a combination of this frequency response of the transducer and the fluid column in the catheter. So this is one way. Now another way may be it is performed that the pressure measurements are obtained at the source where the transducer is introduced into the catheter and pushed to the point at which the pressure is to be measured, or the transducer is mounted at the tip of the catheter. Now this type of device is called catheter tip blood pressure transducer. Okay, so here an unbounded strain gauge or a variable um inductance transducer is used for monitoring the catheter, for mounting also the catheter tip blood pressure transducer. And so major surgery is needed for implantation technique, the third, which is called implantation of a transducer in a vessel or heart. And therefore this technique are normally employed only in research experiments. Okay, they have the advantage of keeping the transducer fixed in place in the appropriate vessel for very long period. So the specific direct measurement techniques are in this way. Just we have told you earlier that catheterization by external transducer, and this will be, sorry, this second will be catheterization by internal transducer also, and third may be the percutaneous insertion type method, and fourth is one, the implantation. Now in brief, what is to be done if it is catheterization by external transducer? Here the sensing of blood pressure through a liquid column is used, and in this method a transducer is external to the body and the blood pressure is transmitted through a saline solution column in catheter to the transducer. And this method basically uses an unwanted strain gauge to sense the pressure or a linear variable differential transformer. Okay, the second method, which is the catheterization method, involving the placement of the transducer through a catheter at the actual site of this measurement in the bloodstream, that is to the aorta, or by mounting the transducer on the tip of this catheter. Third method is the percutaneous method, in which the blood pressure is sensed in the vessel just under the skin by the use of a needle or any type of catheter. Implantation of take the implantation of transducer, this technique basically in which the transducer is more permanently put into in the blood vessel or at the heart by surgical methods. Okay. So these are the direct methods. Now there are different transducers for blood pressure measurement, and we know all of you have heard about the strain gauge. I will not discuss the what is the strain gauge. Here is the uh, general formula which is given over there. So um, s- so the physical resistance transducer, that is direct adaptation of the strain gauge used in the industry for many years. And the principle of strain gauge is that uh, if a very fine wire is stretched, its resistance increases. Okay, and if voltage is applied to the resistance, the resulting current changes with the resistance variations according to Ohm's law. And in this way, the force responsible for the strain that can be recorded as a function of the current. Okay. Now to obtain the degree of sensitivity required for blood pressure transducers, two or four-way strain gauges are mounted on a diaphragm or uh, membrane, and these resistances are connected to form a bridge circuit. Okay. In general, the uh, four resistances are initially about equal with no pressure or strain is applied, and the gauges are attached to the pressure diaphragm in such way that as the pressure increases, two of them stretch while the other two contract. Okay, if it is a uh, bridge circuit forms, then an excitation voltage is applied. So when pressure changes, unbalance the bridge voltage appears between opposite terminals, and which is proportional to the obviously the pressure. So resistors were strain gauges that can be bonded or can be unbonded. In the bonded type, what happened, the gauge is bonded to the diaphragm and stretches or contracts with bending. Okay, the unbonded type consists of two pairs of wires coiled and assembled in such way that displacement of a membrane connected to them it causes one pair to stretch and the other to relax. Now the two pairs of wires are not bonded to the diaphragm material but are attached only by retaining the legs. Because the wires are very thin, it is possible to obtain relatively large signals from the bridge with small movements of the diaphragm. Okay, so uh, so development of semiconductors that change their resistance in much the same manner as wire gauges has led to the bonded silicon element bridge. Okay, only a small displacement of that pressure sensing diaphragm are needed for sizable changes of output voltage with low voltage excitation. So semiconductor strain gauge bridges are often temperature sensitive and have to be calibrated for baseline and true zero. Therefore, it is usually necessary to incorporate external resistors and potentiometers to balance the bridge initially as well as the periodic correction purpose. Okay. So when these strain gauges are incorporated in pressure transducer, the sensitivity of the transducer is expressed not as a gauge factor but as a voltage uh, change that results from a given pressure change. Next, transducer for blood pressure measurement, which is basically LVDT, linear variable differential transformer. So this transducer looks similar to the unbonded strain gauge type, indeed, with respect to the plastic dome used for visibility, the two pressure fittings for attachment to the catheter and for flushing, and the cable coming out of the bottom, they are similar. And such transducers also come in a variety of models with a range of characteristics for venous or arterial pressure for different sensitivities and for alternative volume displacements. Okay. So it should be noted that from the so that these units deassembled into three sub-assemblies: the dome and pressure fittings sub-assembly, the center position consisting of stainless steel diaphragm and core assembly, and the LVDT sub-assembly. Okay, there are two basic diaphragm and core assemblies with appropriate domes that are interchangeable in the coil connector assembly. The first, which is used for venous and general purpose clinical measurements and has a standard size diaphragm with an internal fluid volume between the dome and the diaphragm. So LVTT can be used. The capacitive pressure sensors can also be used to measure the blood pressure. So when there is a difference in what happened, a change in the distance between the plates of a capacitor changes its capacitance. So in a typical application, one of the plate, that is a metal membrane separated from a fixed plate by some uh, space of air gap, and changes in pressure that changes the distance between the plates, thereby changing capacitance. So if this element is contained in a high frequency resonance circuit, uh, the change in capacitance vary with the frequency of the resonance circuit to produce a form of frequency, one type of frequency modulation. So with suitable circuitry, blood pressure information that can be obtained and recorded as a function of time. Now so one advantage of this type of transducer is that its total contour that can be long and thin, so that it can be easily introduced into the bloodstream without deforming the contour of the recorded pressure waveform. Because of this stiff structure and the small movement of the membrane when pressure is applied, the volume displacement will also be very small, extremely small. Okay, and one disadvantage of having this is uh, this type of transducer are uh, unstable and proneness to variation with small changes in temperature also, and it also lead was introduce errors in the capacitors, and this type of transducer is more difficult to use than resistance type. Okay. Now coming to blood flow measurement. So basically all organs of our body, it requires an adequate blood supply. In fact, if the blood supply to a particular organ is not adequate, then the particular organ may not function properly. The ability to measure blood flow in the vessel that supplies the blood to a particular organ, that would therefore be uh, great help in diagnosing such type of diseases. Okay, it's not very easy to measure the blood flow. So the principle, that is gas in a pipe, or the rate of flow of a liquid, that is expressed as the volume of the substance that passes through a pipe in a given unit of time, and flow rates which are measurable usually expressed in terms of liters per minute or millimeters per minute. Now basically the all the blood flow meters currently used in clinical or in research applications, that may be either any one of this type of category, electromagnetic induction, or it may be ultrasound transmission or reflection type method, or maybe thermal convection method, or radiographic, based on the radiographic principles, or the indicator, that is dye or thermal dilution. And here basically the magnetic and ultrasound blood flow meters uh, uses mostly widely used. So these flow meters actually measures the velocity of the bloodstream, and these transducers are to be placed in exposed blood vessel, and these transducers are mainly used during the surgery, and it is used to detect the obstruction of blood vessel where the quantitative blood flow measurements are not required, that can be done by using ultrasounds. Okay, so ultrasound usually helps to detect this obstruction of blood vessel, and to measure the limb segments, uh, as well as to measure the blood flow, which that can be indicated by a lethysmograph, which actually indicates the volume changes in the body. So lethysmography also can be used. I will discuss it one by one. So we have 2 minutes to end this session. If it is ended, everyone please rejoin using the same link to continue the second session. Okay. Do you have any queries, any doubts regarding this up to this much? If you have, then ask me now. Move on to the next slide. So
হ্যালো
magnetic,
স্যার।
yes.
স্যার বলছিলাম